Hello and good day. I am Krasmade Vafoniliu, a level 1 nursing student in the Adventist University of the Philippines. And today I will be performing the musculoskeletal system or the musculoskeletal assessment. So to start off, let me introduce myself to you, ma'am. I am Krasmade Vafoniliu, a level 1 nursing student in the Adventist University of the Philippines. Can you please tell me your complete name, ma'am? Camille Ruth Vafoniliu. So, what do you prefer to be called, ma'am? Camille. Okay, so, Ma'am Camille, today I will be assessing your musculoskeletal system. I will be checking if there are any tenderness, if there are any deformities or complications regarding on that system. Okay, ma'am. So, as of today, I will be needing your cooperation. I hope that we will be able to finish this correctly and successfully. And now we will be I will be doing, or I will be writing all those results that we will be having, but I will be taking down notes, but all those notes that we will be taking, all the results will be kept confidential and will only be open inside the healthcare team and only for you as well, ma'am. And now we will gather all the necessary equipment that we will be using, which only is our lab gown, or our patient gown rather. Now we should wash our hands, observe appropriate infection control procedures, and then we need to ensure quiet and adequately lighted environment as well. I also provided privacy for our client and then place our client in a sitting position. And now, first, let us proceed for our first assessment, ma'am. I will be assessing your temporomandibular joint. So to test that, I will be locating your temporomandibular joint. Okay, can you please open your mouth, ma'am? Alright. So here is your temporomandibular joint. Open. Close. Okay, so I heard a one crepitus sound, one single snapping sound in her TMJ. So as I have located, I have already palpated lightly for the temporomandibular. So I heard a one crepitus or one snapping sound. Now, ma'am, I want you to as I have observed as well, her facial aspect is asymmetrical. It has also no deformities and swelling as well. So there are also no low skin lesions, no lumps or bulges, and no signs of inflammation. So now, as I have located the TMJ, I heard the snapping sound, and now I will be asking the client to do the range of motion. First, ma'am, can you please open your mouth again? Close. I do it like this. Then back. Side. Alright. So, as you can see, our client doesn't have any difficulties doing the range of motion. The client was able to fully do the range of motion exercises. Now, let us proceed for the neck, ma'am. So, for the neck, first, I will be inspecting for any deformities on your neck. So, as I can see, I will also be checking for the cervical spine on the spinous process, the cervical spine, the trapezius muscle, and the muscle between the scapula. So that I will be taking down notes if there are any tenderness. So first, I will be inspecting. All right. So the neck is in the midline, and then it is symmetrical. So now let us palpate for the cervical spine using our thumb and index finger. Do you feel any pain, ma'am? What in here? In here. Alright. In here. What in here? Okay. So our client doesn't feel any pain on her on the spinous process of the cervical spine, and then on trapezius muscle, and of course on the muscle between the scapula. Now, since you do not have any we will now proceed for the range of motion for the neck. Ma'am, I want you to do the flexion, which is to put your chin to your chest. Chin to your chest, your chin. Right. That. Okay, how about you go, you extend your neck like this. Okay, and then I also want to request if you could do this. Like this. One, left, then right. Alright. How about for the lateral bending, ma'am? Like this. Alright. Okay, so as you can see, the client was able to perform the range of motion exercises without any difficulties or any crepitus sounds or snapping sounds rather. And now we're gonna proceed for the shoulders. So for the shoulders, I will be observing the shoulder first. So, ma'am, can you please sit in here? Okay, so as I have seen for the shoulders is symmetrical as well as the scapula in here is symmetrical as well. And then I will be palpating for the sternoclavicular joint, which is in here. And then up to the acromial clavicular joint and to the subacromial area up until to the back. Ma'am, do you feel any pain, ma'am? How about in here? Right. In here? Do you feel any pain? Right. About the other side? Do you feel any pain, ma'am? In here? How about in here? Alright. So, very good. Excellent. The client wasn't able to feel any tenderness or any pain during our palpation, upon palpation. So, I also don't. Now, let us do the range of motion, ma'am. We can now proceed. Firstly, may I request to do this? Alright. Then overhead. Like extended. Alright. Then okay. Now, I want you to stand up a little while. A little bit. Stand up. For the extension like this, put your hands like this. Okay. So, you can now sit. So, the client was able to do the flexion and the extension. Now we will do the abduction, which is to put your hands like this, ma'am. Alright. Up. The other hand. Alright. So now for the adduction, like this. The other one. Alright, so our client was able to do the abduction and the adduction. So as you can see, now we will now proceed for the last two for the range of motion for the shoulder, which is like this, ma'am. You will do it like this. Internal. Alright, so the client was able to reach the opposite scapula. And then for the other one, which is in here at the back. Alright, you can now put this down, the other one. Alright, okay, the client was able to touch the opposite scapula as well. Now, we have finished the range of motions for the shoulder. It was good and it was excellent that the client was able to, can you please go back to the bed? It was good that the client was able to do a full range of motion exercises without any pain or difficulties during the range of motion. And now we will now proceed for the elbows, since we have already finished for the shoulder. So and now we will now proceed on to checking for the elbows. So in checking the elbows, first we need to inspect if there are any contour of the elbows or any nodules or swelling. Alright, so I see that I inspected that there are no nodules, there are no swelling or even signs of inflammation on the elbow. There are also no enlarged muscles or organs as well. Now let us check or palpate the elbow and palpate the medial and lateral epicondyles and the olecranon process as well. So we will put it in a 70 degrees. First, ma'am, do you feel any pain? How about here? Okay, in here. Okay, so about in here. In here. The other one. You feel any pain? In here. About in here. In here. Okay, dito. Dito. Alright, so very good that our client wasn't able to feel any pain during the upon palpation. So I also did not hear any crepitus sounds or snapping sounds upon palpation as well. So now, as I have seen, there are no displacement or tenderness or thickening of the elbow. Now let us proceed onto the range of motion, ma'am. Can you please do this? Extend. Like extend you. Right? Then do it like this. Put your hands like this, okay? Then like this. Okay, very good. Our client was able to flex and extend and to pronate and supinate her elbows. Now we're gonna proceed for the next part or for the next muscle. So first, we will check for the wrist and hands. So we need to observe the position of the hands in motion if ever the movements are smooth and natural. So as what I have observed a while ago, our client's hands is relaxed, and then the fingers are slightly flexed. That means its movements are natural and smooth. Now I will be inspecting the palmar and the dorsal surfaces of the wrist and note for any deformities and angulation from the radial and or ulnar deviation. Okay, can you please do this for me, ma'am? The other one. Both. Okay. So there is no thickening onto the palmar surface. Okay, there are also no thickening at the back or in the dorsal surface. So I have seen there are no redness, or there are also no the wrist is symmetrical, and then there are no signs of nodules or any bugginess that could be found in the wrist. And also we will now be inspecting for palm contours. As I have said a while ago, there are no thickening, and obviously there are no contractures of the fingers, which is a good thing. Ma'am, now we will proceed for the wrist. We will palpate the distal radius and ulna on the lateral and medial surfaces, ma'am. So in order for us to do that, we will be doing this one. Do you feel any pain, ma'am? About this one? There. You will also be palpating the groove of each wrist with your thumbs, of course, with our thumbs rather. Okay, do you feel any pain? Okay. Now let's palpate for the carpals, metacarpals, and the phalanges. Do you feel any pain, ma'am? About here. Okay, the other one. Same procedure. Do you feel any pain, ma'am? About here. 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 Alright. Now on the middles of the fingers, do you feel any pain? Here. Here. About the other one finger. My hands. Okay. About here. 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 Alright, so in the middle. Now we will palpate for the last one, which is in here. We will palpate it for the medial and lateral aspects of each joint between the fingers. Do you feel any pain, ma'am? About in here. 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 About in here. Here. About here. Here. This. Okay, so very good. The client hands, I did not feel any tenderness, because as what we have the clients that did not feel any pain at all, and there are no difficulties as well. So now we will go for the range of motions for the lateral, for the wrist and the hand. So in order to do that, ma'am, I want you to put your palms down and put your fingers. Please be on the. Let's change chairs, ma'am. You can go. Okay, so can you please put your palms down and then put your fingers toward the floor, above the ceiling, like this. All right, and then like this and this. All right, so the client actually was able to flex, extend, adduct, and abduct her wrist. So now her wrist. So now let us proceed for the fingers. So I want you to make a tight fist. Alright, so with the hands across the knuckles. Very good. You can do the flexion. Now we need to extend and spread our fingers. Okay, very good. How about we spread our fingers apart as well? And then we also bring back our fingers together. Okay, very good. The client was able to do adduction, extension, flexion, and abduction. Ma'am, you cannot sit here. Okay, very good. Now we will now proceed on to evaluating the muscle strength of testing our wrist flexion. So I want you to grab my fingers. Grab as hard as you can. Alright. So the client has equal strength because the client's both hands gripped my hands equally with strength. And now we will proceed on to the spine. Since we have finished the range of motion for the wrist and the hands, we will be proceeding for the spine. So in order to do that, I have already draped, or I have gowned the patient to expose our entire back. And then we also need to observe the patient's spinal profile, in which we observe the cervical, the thoracic, and the lumbar curvatures from the side. So I want you to sit here, ma'am. Alright, so as I have seen, the back of our client, okay, in the side, both the spine is in the middle or lateral midline, and then as what I have observed, the patient's spinal profile, such as the cervical, the thoracic is the cervical and the lumbar are both concave, and of course for the thoracic it has a convex shape, and then there are also no abnormal curvatures or exaggerated curvatures under us looking at the side. Now I want you to stand up, ma'am, and then bend down like this. I will be checking for your, like this. Reach for your toes. Just don't mind the okay. Alright, so bend as hard as you can, please. Okay. Wait for a while. Okay, so the client's lateral curvature from the back. Can you please sit here? Okay, so the client's, as I have expected for the client's or the patient's lateral curvatures, from the back, the patient I asked the patient to bend. Rather, there are no deviations, and the spine is in the midline or in the center. That basically means it's normal and doesn't have any scoliosis at all. So now we will now proceed on to in the sitting position. I will be checking for the spinous process, ma'am, and then for each vertebra I will be assessing I will be palpating for tenderness. Okay. Please tell me if you feel any pain. Did you feel any pain, ma'am?
No.
How about for the cervical?
No.
In here? In here?
No.
In here?
No.
Okay, how about in here? In here? In here? In here? Let's go to side, ma'am. How about in here?
No.
You feel any pain here?
No.
In here? Alright, so very good. How about in the bottom? Do you feel any pain here?
No.
Okay, now we are now going to be palpating again the paravertebral muscles for tenderness and spasm. So, in here, do you feel any pain?
Mm.
But in here? Here? Here?
No.
Here? Here?
No.
Okay, very good. Now, since we have finished checking for the paravertebral muscles for tenderness and spasm, we will now proceed on to for the spinal column range of motion exercises. Ma'am, I want you to stand up in here. Okay, wait for a while. So for this range of motion, ma'am, I will be requesting you to bend again and reach for your toes as hard as you can. All right. So next will be extension, like put your back. All right. Very good. Now next is from side to side, lateral bending. The other one. And rotation. All right. So I have not heard any crepitus or any snapping sound from the spinal column, or yeah, there are no crepitus and snapping sound. Very good, ma'am. You can now go back to your seat. All right. And now we will now proceed for the other another musculoskeletal system na part. So which is firstly the hips. So I will be assessing for symmetry of the hips, ma'am, and for the leg length. Again, can you please stand up and go put your back like this? Okay, so very good. So your leg length is symmetrical, and then we can clearly see that the buttocks are symmetrical as well. So now I will be inspecting for the anterior and the posterior surfaces. There are no deformities or any bulges or any signs of inflammation in this part. Okay, the iliac crest, we can clearly see that the iliac crest is not being deformed, or there are no inflammation as well. So now we will now going to be palpating for the anterior and the posterior aspects of the hips. So ma'am, can you please tell me if you feel any pain? Do you feel any pain, ma'am?
No.
How about in here?
No.
All right, in here?
No.
Okay, about in here?
No.
All right, so the client wasn't able to feel any tenderness or any pain onto the anterior and the posterior aspect of the hips. Now I want you to lie down, ma'am, in there. In here, can you please lie down? Right? Lie down like, all right. And now we will now be doing for the range of motion, since we have finished the inspection and the palpation of the hips. So ma'am, I want you to flex. This is going to be flexing. Okay, so right. Okay, the client was able to flex her hips. Now next, the other feet. Okay, very good. So the client was able to do that, or to do flexing. Now let's do the extension. We will be extending the hips of our client by, since our client has lie down already, we will bend the knee and lift it up. All right. So we have extended. All right. Very good. So our client was able to do the extension, in which we have already finished. Now let us proceed onto, we will now proceed, ma'am, onto the adduction and the adduction of your feet. Abduction away from the midline, adduction rather, abduction, the other one, same procedure. All right, very good. Now we will now proceed for the external rotation and the internal rotation. So in order to do that, since our client has lie in bed already, we will bend the knees and turn the lower leg and foot across the midline. So, 1, 2. Right, did you feel any pain, ma'am? Right, no? Other one. 1, 2. Alright, feel any pain? Okay, so our client our client was able to do the range of motion without any feeling of difficulty or pain during the range of motion procedure. So that is very good. Now we will now proceed on to checking the knee of our client. We need to check the alignment of the contour of the knees. We also need to look for normal hollows around the patella. Okay. So there are the normal hollows of the patella is present, and then the alignment and the contours of the knee, the other one. Okay. There are the hollows on the knee is present, and I will be observing for atrophy, bruising. There are no bruising and atrophy here on the knee. Now I will be checking, or I will be palpating for the body for the body landmarks such as the tibiofemoral joint and the patellar joint using my thumb. Alright, do you feel any pain, ma'am? But in here.
No.
Alright, so our client wasn't able to feel any pain. How about in here? Do you feel any pain?
No.
But in here?
No.
Okay, very good. The client wasn't able to feel any pain. So I can see that there are no swelling, there are no pain, there are no tenderness that could be present onto these margins, along these joint margins. Now, we will now proceed on to doing the range of motions for this one. So first, we will bend and flex the knee. Ma'am, I want you to do squatting. Like this. There you go. Alright. Up. Stand. Okay. So the client was able to do flexion and extension of her knees. You know about sit down again. Right, the client was able to do flexion and extension of her knees. Now we will now swing the lower leg to the midline. Can you please relax your feet? Alright. The other one. Alright. So the client was able to do internal rotation and external rotation of the knees. Now that is very good because we have finished for the knees. And now we will now proceed on to checking the ankle and the foot of our client. Since we don't have something that could, I just gonna put it like this. Okay, as you can see, this is the foot of our client. So now we will be checking for any deformities. So as I can see, the ankle and the foot, there are no deformities that we could find in our client's foot. So as there is also no swelling. But for the bottom, there are no calluses or any corns that could be found. Okay, very good. So the other one. There are no swelling, nodules. There are no nodules, no varicose veins. There are no thickness or calluses. There are also no corns. Now it's time to proceed for the palpation. First, we will palpate the anterior aspect of the joint using our thumb. Do you feel any pain, ma'am?
No.
Do you feel any pain?
No.
How about in here?
No.
In here?
No.
In here? And then the Achilles tendon in the back part. This one. Do you feel any pain, ma'am?
No.
About in here?
No.
Here.
No.
Okay, very good. Now, for next is the metatarsophalangeal joints, and then we also need to compress the foot to between the thumbs, and fingers. No? Okay, so firstly, we will be palpating for the metatarsophalangeal joints. Do you feel any pain, ma'am?
No.
How about in here? We also need to palpate the heads of the metatarsals and the grooves, of course, between them. Do you feel any pain?
No.
In here.
No.
In here.
No.
Here. Here.
No.
Here. But here. Okay. No.
No.
Alright. The other one. Here.
No.
Here.
No.
Here. Okay. Very good. About this one, last one.
No.
So she did not feel any pain. Now let us proceed on to compressing the feet. Do you feel any pain now?
No.
Okay. Very good. Compress. Feel any pain?
No.
Okay, very good. So now, lastly, we will now proceed on to the range of motion for our client. Okay, ma'am, can you please point your then extension up to the ceiling like this. Okay, the other one. Very good. How about eversion? Can you please stand up, ma'am? And do it like this. The other one. Then for next one is like this. And then the other one. And now that would be all. I have just showed you the way she did the range of motion, since it was really hard to see the angle. So as you can see, she was able to flex the plantar. She was able to do the plantar flexion, do the ankle extension, and then the other one, the eversion and the inversion, without feeling any pain or difficulty. Ma'am, thank you so much for cooperating for this procedure. I will be giving you the results of our assessment later. I will be giving validation. I will be having for validation and summarization for you, ma'am. Thank you so much for cooperating. I hope you will have a good day. Thank you so much.